Hi, everyone. This is Dr. Janice Makela. And once again, you're here with us talking about all things geriatrics, hospice, palliative care, and of course, cannabis. Uh, this is Questions and Answers with Dr. Makela, and I'm here for your questions. I'm going to just do a little bit of a check on the tech issues first. Having a little bit of an issue with the LinkedIn. It was showing me as not um, connected to the LinkedIn. So I just want to see real quick if people are wanting to join, you might want to try. Well, it does say I'm live, so that's good. I don't think it's showing up as a event. Let me see. It's just showing up as a post. Oh, well, there is. Okay. I don't think the event itself is showing up, but it's still on my webpage. And of course, you can always watch me on YouTube and Twitch. So, hmm, I'm getting a little bit of a lag here on my channel here. And I don't know if that's me or if it's just a little bit of feedback on things. Let me know if you guys are seeing this lag a little bit. Okay. So, today, let's talk a little bit. There's a few things I wanted to talk about. So much stuff in the news. First, President Trump came and posted a site about CBD on the webpage, on his webpage. He did it on Truth Social, I believe. And it wasn't, he didn't actually say anything. I really wish he had, but he just reposted a previously done post. It was actually by a friend of mine, Dr. Kaplan, who made it, about CBD. And it was about CBD and seniors and how seniors benefit from it, which is true. Seniors benefit a lot from CBD. They also showed how seniors are, it talked actually about the endocannabinoid system. I believe that is the first time I've seen anyone in any political circles even use the term endocannabinoid. So that was really cool. And he even talked about it. They had a nice little graphic about how the endocannabinoid system is the master system of your body, which it is. As if you've been following my channel, you know that we have a system in our body. It was only discovered in the 90s. Most doctors still don't learn about it in medical school. And this video even talked about that and how it's not being taught about in medical school. Most doctors still don't know about it. And what is crazy is that the endocannabinoid system was discovered in the 90s. If you're a millennial, you are the endocannabinoid system is older than you. All the Gen Zs out there, the endocannabinoid system is older. Now, obviously, the system itself is much older, but the discovery of the endocannabinoid system is from the 1990s. It was first, the very late 80s was some of the first things that was discovered. I think anandamide was first discovered in like 88 or something. I don't think it was even the CB1 receptor yet. And then over the years in the early 2000s is when we started discovering that Tylenol works by the endocannabinoid system. And every year, new and new things get tied to it. So, like I said, most recently we discovered hydrochlorothiazide, a very common blood pressure pill is used by it. So, I'm excited because maybe, just maybe, we might get some push about cannabis being legal for people who need it medically. Because if you can understand the endocannabinoid system, then you can understand that while there's a lot of things, and I've mentioned the fatty acids that we eat, a lot of the medications that we use, there's a lot of things that use the endocannabinoid system, but they are not actually, but they use the endocannabinoid system, and sometimes people have an overactive endocannabinoid system, and that can be treated with other things. But then there's people who have a broken endocannabinoid system who aren't making enough of these endocannabinoids to function. And those people with a broken endocannabinoid system, one of the things that can help them is cannabis. Now, will pharma years down the road come out with drugs that use these same receptors and maybe fine tune them a little bit so you can have all the benefits without the high or, all these other different things? Maybe, right? Um, but right now, they haven't. And because of that, the endocannabinoid system, sometimes the best thing we have is cannabis. Now, so exciting news. If they understand that the endocannabinoid system exists, then maybe, just maybe, they'll understand that we need medical cannabis for people who have a broken endocannabinoid system. And this video actually does a very good job of doing it. Dr. Kaplan, I believe, put it on his website, CED. If you want to, I might put the link below too. If I know I have it on my recent post also. Meanwhile, other things that we were talking about. So we talked about how some people might need cannabis. We talked about how there's a kind of a movement. Maybe, just maybe, it might be moved towards legal within soon. Are patients being honest with their doctors about cannabis use? I recently reviewed an article, and I wrote a thing on LinkedIn about it that showed that patients, something like 30% of patients in a state, I think it was Washington State, has legal med and rec, and they looked at patients who had a form in their chart asking about cannabis use, to use cannabis, da da da. And so they then went to these patients and they gave them a private survey. They incentivized it, say, hey, we'll pay you $5 and, 20 if you meet certain criteria, da da da, and come in and do the survey for us. So they incentivized them to do a survey. And then when they did the survey, they asked them, so tell us on the down low, using cannabis? And if so, why? And what they found was something like 28% of them, I believe that was the number, somewhere thereabouts, high 20s, were using it with a medical card. They had a medical thing, they were getting it from the state through the medical program. And something about 35%, 34, we're not necessarily getting it, we're getting it medically, but there was a percentage there that they weren't getting it through the medical card, but they were using it for medical indications. So they're like, okay, I didn't bother with the medical card, but I use it for sleep, or I use it for anxiety or pain or something like that. And so that was like 38% of all these patients. And they went back to the chart. Again, remember, all these patients had a screen in the chart for cannabis use and then they threw an AI at the chart and said, screen for everything that could be cannabis, cannabis adjacent, every word, pull it all out of the chart. And when they did that, And they tested the AI, by the way. They tested it on some like samples and, validated the AI. Um, and when they did that, they found that something seven, I was at 7 or 9%. It was like again a really small number. Let me look it up real quick here because I can see it. It was a tiny, tiny percent that actually had it in the chart. So that was um, that was really interesting. That was not the case there. That let's see, it was 4.8. I thought it was higher, and maybe that was higher for some other part of it, but 4.8% of times they found it in the chart. So they were like the vast majority of times. Patients aren't necessarily lying to you, but they're not volunteering that information either. And so one thing you can do is be very open, be very clear. Um, don't be judgmental. Don't be finger wagging. I personally think we should remove it from the part of drugs of addiction. Do you smoke? Do you drink? Do you do drugs? And then I think maybe we should add cannabis to where we ask about herbals. And do you take any herbals or cannabis? Is personally where I think we should ask it. So any medications, any over the counter medications, any herbals or cannabis. And just assume that it's being used as like a medicine. And then that way, maybe we'll take some of the judgment off of it so people are a little bit more open about answering questions. I personally think that makes a lot of sense. Now, they also talk about how you should also document the health reasons. I've said this before, and I'm really glad they have it in their journal article, which is medical cannabis is a legal registration. In my state, all it does is get you cannabis with less taxes. You don't have to pay as high of a tax rate if you use it for medical cannabis. And so, but you have to buy a medical card. So you have to spend so much money to buy a medical card, and then you save on the taxes. And kind of like a buyer's club sort of thing, right? In some people, where maybe they're just using it transiently while they're getting nausea for their chemotherapy or something, that they don't need it every day or consistently, where that $200 card may not be worth the value, they may not be bothering with it. Plus, most of the time you have to pay cash to a doctor to get your medical card because most doctors don't sign it. And so as a result, what you need to do is, you end up paying $300-400 to get a medical card to save on the taxes. And if you don't buy that much, you're not going to save on the taxes. It's like I said, sort of like buying a buyer's club, right? So as a result, you have people who aren't medical, who aren't technically in the medical program, who may be using it for medical reasons. So they say that every patient should be asked, are you using it for a medical reason, regardless of if you have a medical card or if you're using medical cannabis properly? And see, because there's a few things. One, not only is it a little bit more non-judgmental, and again, that artificial designation of medical versus recreational. And then don't forget, there's people who get the medical card who just barely qualify and get someone who can rubber stamp it so they can save on the taxes, right? But so there is that. Now, you have people who are using it, so you should ask them, why are you using it? Not only will this help with that condition, you might unmask, and they mention this in the article, you might unmask a condition you didn't know about. They're treating, excuse me, they're treating their insomnia, they're treating their anxiety with cannabis on their own, their migraines, and they haven't told you. Why? Because they don't want to talk about the cannabis or the cannabis is working, you know. And so you should ask about that because then you can find out, is there a different treatment? Sometimes people use cannabis and it's not the right thing to use. I know. What? Cannabis doesn't treat everything? No, it doesn't. Sometimes people use it and really it's a better choice. There's other things. I've talked about this with like anxiety and PTSD and some psychiatric disorders. Sometimes people use it and it helps them get through the day and it helps them feel better. If someone told me they were using it for their PTSD, I'd be like, great. Let's talk about what else we can do to help your PTSD. Can we get you a psych referral for some cognitive behavioral therapy or EMDR or something? But then there's also sometimes there's people who use it for a condition, but they're not so much using it for a condition as they're using to escape the condition. Right? It's, I don't want to think about this. I'm just going to totally get lost in a haze so I don't have to deal with things. That's not healthy ever. Right? So, what we often say is that people who we want to see who's using it healthy, who's using it good. And I'm not saying enjoying yourself. That's a different thing. I'm talking about someone who's completely escaping life because they've been through some sort of trauma or they have some sort of condition that keeps them, and then the cannabis is inadvertently compounding it because they think it's helping, but really they're not living their life to the fullest. And if I can get them the help they need, and maybe they taper down the cannabis, or maybe they use it, but use it in a healthy way, or maybe they have to stop it even, right? Um, I can help. A person can live their life more full. Or maybe I look and say, wow, yeah, no, the cannabis is really helping you. I see you can leave the house and go to the grocery store and socialize with your friends and do everything you need because the cannabis is helping you. That's great. Let's talk about what else we can do to help you. So that's kind of a take on that. And, that's what they were saying. Now, they were in JAMA, so they were a little bit more of the, so we can talk about what else we can do. But I think there's times you're going to look at that and say, no, no, it's helping your MS. Keep using it. So, yeah, JAMA does have a little bit of a bias against cannabis. I've seen this in a few of their articles. Now, other things to talk about. So that was like one of the really so a couple exciting things that have come up, right? The other thing that we've seen is, oh, yes. So, seed oils. I'll talk about that briefly. So there are, as we know, the endocannabinoid system exists independent of cannabis. While certainly I talk a lot about cannabis, the endocannabinoid system exists independent of it. And one of the reasons it exists is to help us process the fats in our body. Well, not really, it's kind of the other way around. The fats in our body help our endocannabinoid system. So the fats we eat, they're omega-6 fats, which are a lot of the seed oils. Specifically, well, a lot of our oils have omega-6 in them. And omega-6 is essential. We need it. It's important for us. It makes the endocannabinoids. It is actually processed into anandamide and 2-AG by our body. And so we need it. We can't make it. We need to take it in the food we eat, and it's essential. Now, there are two others, omega 3, which is fish oil, and omega 6, which is like olive oil. Well, it's also flaxseed oil and all of these omega 3s, right? But flaxseed oil, hemp oil, right, are full of omega 3. And omega 6 is olive oil, avocado oil. Those are all good sources of omega 9. I'm sorry, I said 6. And so those balance each other. And I think I've mentioned this before in the stream before, but sometimes what happens is people really rail against seed oils are evil. Now, the people railing the loudest about seed oils are evil often are selling you beef. You know, seed oils are evil, so make your French fries in beef tallow. Now, are beef tallow French fries tasty? Sure. Sure, they are. Are they good for you? Please, let's not pretend they're good for us. Just because, people are railing on the seed oils, it doesn't make the saturated fats like beef tallow healthy just because something else might be bad for you. But people make that jump and they're like, "Ooh, beef must be healthy since seed oils are bad." Now, are seed oils bad? I don't really think so. I think there is perhaps something as too much of it, though, in us. Um, Particularly your corn oil, your safflower oil, your sunflower oil have extremely large amounts of omega 6, and not even really the ratio. There's a huge talk about the ratio. And when they've done studies on the ratios of 3 to 6, it doesn't really hold out in human studies. But were some studies about safflower done many years ago. Um, and some suggestion that when you actually look at these particularly high omega 6 oils like safflower, sunflower, and corn oil, and to some degree soy, that you might be having some inflammation and harm to the body, and that's not a good thing. And then we know that omega 3 tapers that down, and so does omega 9. And that really goes with everything we know about like a Mediterranean diet, right? That adding fish, adding olive oil, avocado oil, avocados, in a South American diet are healthy for you. Mexico, actually, avocados. That those types of things, those types of fats might be balancing out some of the effects of a high omega 6. Now, and again, I think there's something to be said when you look at, there's a large amount of omega 6 in those oils. Now, people say seed oils. They talk about, canola, so bad. I'm like, okay, guys, canola actually has a fairly decently low amount compared to like the other ones of omega 6, and even has some omega 3 in it. So, one, that's good. Now, two, there is some data to show that if you fry with canola oil and then you use that oil again, that the frying process might break it down into other things that aren't good for you, trans fats and whatnot. Some very unhealthy chemicals can pop up when you fry with trans fats or fry with canola, and then save it and refry it, and you keep doing that. To try to save money. Well, we'll strain it, keep it. People would do that all the time with fats, but it turns out not the healthiest thing to do. But by itself, if you're just going to cook with it, if say you're going to cook your eggs with it instead of butter, or add it to a baked good or something like that, canola, I personally think someone has it out for canola. Maybe it's the beef industry, maybe it's someone else, but everyone's been talking about how bad it is. And I got to think the data I see on it doesn't suggest it's that bad. And Again, it is a it's an it's an unsaturated fat. The data when and, and it's interesting because I think maybe this might be part of the reason that we see these studies where these fats might be, where they say, oh, in humans, these fats are good in people. I wonder if maybe it's the canola effect. If they're saying, okay, we're going to look at all of these oils, corn, olive, or not corn, corn, soy, canola, and if they compile them all together, and most people are using canola, because really, I think a lot of people in the last decade have really switched to using canola. Um, that's a good thing. But then you have these big industries that maybe don't want people to stop using corn oil. And then processed foods are bad for you, period. Right? We all know this. The heavily processed food, they're too easy to digest. And these processed foods often have a lot of corn or safflower or sunflower oil in them in their processing. And that might be part of the problem. But again, please stop saying seed oils are bad, so let's eat beef tallow. That's not healthy for anyone. But again, it's interesting. We talk about the endocannabinoid system, and that's part of it. So now, other things to talk about. See if anyone's here today. I know I had a little bit of a hiccup with validated whoops. AI. So, oh wow, there is a serious lag on LinkedIn. I'm still talking about the AI there on it. That said, I don't know if anyone's watching it or not, but if anyone's out there, come and say hi. Excuse me. If you happen to be on YouTube, again, feel free to chime in. There's less of a lag on YouTube. Now, we talk about the endocannabinoid system. I talk about cannabis. I've talked about how the endocannabinoid system is tied to our health. I've talked about how more and more patients are using cannabis and not talking to us and not telling people, not telling their doctor. I'm talking about how the feds slowly, ever so slowly, are talking about just maybe making medical cannabis legal, rescheduling it, taking it out of Schedule 1 and into Schedule 3. And if you do that, that'd be great for some of our patients. But with all these changes, doctors still don't know anything about cannabis. We still don't learn about it in med school, aside from it being addictive. We don't learn about the endocannabinoid system. The endocannabinoid system is more recently discovered, or more has been around. We've known about the endocannabinoid system longer than all of Generation Z has been around, and most of the millennials. It was discovered in the late 80s and defined later. I said that earlier. And because of that, it drives me nuts that we still don't learn about it. It is tied to our health. It is tied to our wellness. We have it on our pancreatic islet cells, the cells that make insulin. We have it on our liver. We have it on our kidney and on our heart and our blood vessels and our brain. It is associated with neurologic development and the degeneration of neurologic diseases is associated with the loss of the endocannabinoid tone. Diabetes, blood pressure. They recently discovered a blood pressure pill, hydrochlorothiazide. I said it earlier, works by it. We know all this, but doctors don't learn it. Probably one of the biggest challenges I face is I am trying to educate doctors about this. I have this program here for everyone else, right? But I'm one person. I can have this program every Thursday and tell everyone a new fact about cannabis and how to use it for your patient, for yourself, and what to talk to your doctor about, and the latest news and answer your questions. But I'm one person. And, in a country of, hundreds of millions, right? And not to mention a whole world where people are starting to wake up to the fact that cannabis is a medication. My one little voice is not going to be enough to educate everyone. And I realized, I said, I want to educate people, but if I can educate doctors, if I can educate doctors about what they need to know, then I can amplify that message. Because then it's not just me talking to a room full of 50 patients or all of my patients that I might see. It's me telling maybe a room full of doctors or a bunch of doctors or a doctor, and then each of them has hundreds of patients they treat, and they can talk about it to their patients. So it's a much more efficient means for me to share this with doctors about cannabis. So I've created a program for doctors, by a doctor, to educate not just about cannabis, but about the endocannabinoid system. Again, letting people know the endocannabinoid system's real and is tied to our health. And sometimes when it's broken, people might need cannabis. And then I hear people say, but I don't want to prescribe cannabis. That's not my practice. It's not your practice, but it is your patients. 30% of your patients are using cannabis, at least in that one survey, right? And and it might be less, it might be more, but every day, more and more people are using. There were studies show that the geriatric population has an increasing growth of people using cannabis. And so as more and more people are using it, you're going to have to learn how to treat patients who use cannabis, because we have to change our mindset. We have to stop thinking, oh my gosh, it's a drug of abuse. Well, shame on you. You should stop taking it. And let's let's talk about sending you to psych for addiction therapy. In fact, that was a whole article, not just published this past year, talking about how we needed to screen people at the VA so we can send them to psych for therapy. And I'm like, no, screen them so you can see if they're maybe using it to treat their PTSD or something else. So I would say that we are doing this wrong. We are, as a doctors, approaching this whole system wrong. We are looking at people as abusers when in fact we should be looking at them as patients who are using an alternative medicine because something they have isn't being treated by general medicine. Now, sometimes that's because the general medicine hasn't caught up yet. Cases like endometriosis, we don't have a lot of great treatments for. We already know that cannabis is often better than some of the medications for nausea um, in chemotherapy. We know that it can help. And sometimes, really, when you're talking about the side effects of cannabis versus the side effects of an antipsychotic for um, agitated delirium, not delirium really, agitated sundowning in a person with dementia. Maybe if you're talking antipsychotics, I think cannabis is on the table. When you talk about the different risks, I've mentioned that before. But changing that mindset and not saying it's a drug of abuse. If you use it, it's on you because I didn't prescribe it, because no doctor can prescribe it. It's Schedule 1. Even doctors who quote unquote prescribe cannabis are really only certifying that they have a medical card. Oh, I'm certifying that you qualify for this. You're not actually saying, um, I'm prescribing it. And that mindset that we don't prescribe cannabis is hurting our patients. Patients are suffering because we think that since we can't prescribe cannabis, that means we can't tell them anything about it, that it has to be on their own head if they use it. And that's not right. That's not right. We should be their guides. We should be their colleagues. We should be there for them. They're our patients. When a patient says they use cannabis, we should ask them why. As that article even recommended, we should ask them why. And then we should be there and then say, okay, let's talk about it. How does the cannabis help you? How are you using it? How much are you using of it? If they told you how much are they using, would you know if that was too much or just enough? If they had side effects, would you know about it? Would you know about it if they had hyperemesis syndrome from it? Would you know if they didn't, but that they had vomiting and it was something else entirely? There's a lot of studies about, now that they've educated doctors that cannabis hyperemesis syndrome exists, that now it's being overdiagnosed because anyone who uses cannabis who comes in with vomiting is being told, oh, it's cannabis hyperemesis syndrome. It's like, no, it's, not always. There's been more and more cases of people who they find out, no, it was appendicitis. It was a gallbladder attack. It was pancreatitis. It was something else. And it was missed because the doctor really didn't know what cannabis hyperemesis syndrome was, besides the fact that people who use cannabis come in wanting and to vomit, or with chronic vomiting. So, would you know that? Would you know drug interactions? The two most common ones that, not common, but most scary ones are warfarin, where there were cases where people using cannabis had warfarin that was sky high. Now, thank God, not too many people are using warfarin anymore. But another one, would you know about cannabis use in people who are taking transplant drugs? Now, there's actually some good reason that I would suggest that people who have had a transplant really think twice about using, especially fresh cannabis. Um, but would you know why? Well, tacrolimus can interact with cannabis and has been reported being 4 times the normal level, which is really bad because that really is suppressing your immune system at that point. Um, and plus, you get toxicities from tacrolimus, a lot of them, right? And so you have to be careful. Um, Also, if you're smoking it, a person with immune disease can have um, a person who's smoking it with an immune disease can actually get aspergillosis. Oh, a person with immune disease can get aspergillosis. My tongue tied. How embarrassing. Aspergillosis. There you go. Excuse me. So that is why we have these are things that doctors need to know. This should be part of your normal exam. We need to get out of this mindset that it's not my problem. We need to get out of the mindset that people are just using this. I didn't prescribe it, so I don't have to worry about it. That's not the case. Just because your patients didn't prescribe it doesn't mean that you shouldn't use it. Wait, no. Just because, my time, I apologize. My tongue tied there. Just because you're patient. Long night. So, I don't think we have too many people watching tonight. Again, I had some issues with LinkedIn, and it seems that we're not getting anyone being able to access it. So, unfortunately, I'm not getting much in the chat today. Um, I might actually wind things up a little bit because I've gone through all my talking points. and and like I said, I don't think we're going to have any questions to be able to answer today, unfortunately. Hopefully by next week I'll have the tech issues uh, figured out so that people can join us and be able to ask questions and interact. But mhm. Mm. So it's a little bit early. It's about 15 minutes earlier than I normally would wind up for today. So I apologize to anyone who maybe did log in the last few minutes and said, "Oh no, I want to catch Dr. Makela." But I think I'm going to just wrap up since we're not going to have any questions and answers today. Since, like I said, I don't think people can access it very well through LinkedIn today. Um, and I'll just sort of wrap things up. And I hope you guys all have a great evening. Take care. And I'll hope to see you all next week. Bye.